Rachel, appreciate your time. Take us through exactly what a code brown means and just how severe that health worker shortage is.
Yeah, look, Ash, that health worker shortage is the key thing here. The situation in Victoria is that at the pointy end, at the ICU end, at the moment, we're actually not seeing numbers that are as high as what we had back in October at the peak of the Delta wave. But what we are seeing is that general hospital admissions are much higher than they were then, largely because there's so much COVID in the community. There are a lot of incidental admissions that are happening. A lot of people who are going to hospital to have a baby or going to hospital because they've got a broken leg are also turning up with COVID. And that means that all of the infection control procedures are still required, all of the PPE, the fact that they need to be put in a separate ward and have specific staff for that still needs to happen, even though in a lot of cases their illness isn't anything like as severe. And the other thing is that, like every other industry at the moment, health workers are many of them getting COVID themselves and having to stay at home. We've got lots of people who are trying to take annual leave because it's summer. And essentially there just aren't enough staff to go around. So we've had the Andrews government announce this code brown today. Essentially, it kicks in at midday tomorrow. Essentially, it's not a huge change, really. We sort of had the Deputy Secretary of the Department the Deputy Incident Controller today explain exactly what it means. And he largely described it as a formalisation of a lot of things that are already happening. But it will allow hospitals, for example, to ask staff members to defer leave and that kind of thing. It'll apply to all of the major every public hospital in Melbourne and 6 of the most major public hospitals in regional Victoria as well. And they're saying that they expect it to be in place for 4 to 6 weeks, but it really depends when we see an easing of hospital admissions. We're already, we think, seeing the peak in Victoria in terms of case numbers, but it is expected that the peak of hospitalisations and ICU admissions might be a little bit later than the peak in case numbers. Although that wasn't the case with the Delta peak and the 2020 peak, we actually saw, I think because there was a delay in reporting positives, we actually saw that peak in hospitalisations happened at much the same time as the peak in cases with both that Delta wave and that 2020 wave. So it'll be interesting and hopefully that is what happens this time and we can move on from Omicron. But certainly health workers are dealing with a pretty tricky situation at the moment.
Yeah, I saw that Brett Sutton was asked about the peak scenario today and he seemed to be not completely sure. I mean, I guess the reality is that they can't tell until it's actually over and those case numbers do start dropping dramatically. In terms of the modelling that they have as to where things are going, is it pretty much on track?
Look, I think so, although I'm sort of hesitant to really place much value in modelling because it's been so far out pretty much in every other instance, going back to 2020, but certainly more recently, all of the modelling we had coming out of the Delta wave forecast that things were going to be much, much worse than they ended up being. And certainly we are already seeing a bit of those hospital admissions are still going up, although they went down in Victoria today, both at an ICU level and a general hospital admission level. They're still fairly high. They may continue to go up for a few days, but we are seeing the rate of growth has slowed a little bit, even though they are still going up. So hopefully that continues to slow and we do, see that flattening of the curve and then the path downwards in coming days. Brett Sutton said yesterday he was sort of talking about, possibly not reaching that peak until mid-February. Looking at the numbers, I'm a little bit more, and what's happening, in other states and what's happened in overseas jurisdictions, I'm a bit more optimistic. I really hope, if you had to ask me to put money on it, I think we're going to see that peak a lot sooner than mid-February, possibly even, later this week or next week. But it really is, it's hard to predict, and you can't really tell what will happen until it actually happens.
We're all looking forward to the National Cabinet meeting on Thursday. What's the Victorian Government's priorities going into that meeting? I see that Victoria seems to be pretty much on the same page as New South Wales when it comes to getting kids back to school on day one of term one.
Yeah, absolutely. We've got Daniel Andrews met with Dominic Perrottet over Zoom last week. They seem to be on a pretty strong unity ticket about getting kids back to school. We asked James Merlino, who's both Education Minister, Deputy Premier and Acting Health Minister at the moment. He was up this morning, and we asked him about whether Victoria is going to do the same as New South Wales in terms of requiring kids to do. I think New South Wales is requiring children to do 2 negative rapid antigen tests every week to be able to go to school. We asked whether that'll happen in Victoria. He wouldn't sort of outline exactly what the plan is, but it sounds as though Victoria and New South Wales are going to be pretty much on the same page. So I guess we'll wait and see, and it'll also be interesting to see given what has been a huge shortage of rapid antigen tests, whether the onus will be on families to provide those rapid antigen tests, or whether states will come to the party. We saw the first 3 million of Victoria's 44 million rapid antigen tests start to arrive this week, and I think they're expecting millions more later this week and in coming weeks. So hopefully they can, be put to use to help, I guess, make, students and their teachers feel much more confident in getting back to school and not being stuck at home doing home learning in 2022.